Thanks for joining us today at CAD/CAM Hacks. Today we're going to take a look at choosing the proper scan body per the application for your digital impression machine. Now, when clinics are moving from the traditional analog impression for implants and they're looking to incorporate digital impression, the question inevitably always comes up, which scan body do I use when I'm sending the scan to the lab? Or which scan body do I use when I want to make a CEREC implant crown in-house? So today we're going to review the couple different options that you have per the application, and ultimately we're looking to end up with a beautiful restoration like this that may be on top of a custom abutment or maybe on top of a tie base. So let's take a quick look at the multiple options that you have in the way of scan bodies. So now that you've made the jump from analog impressions to digital impressions, you're going to want to start scanning your implants. It's much easier than taking an analog impression, and it's more cost effective than an analog impression for your implants. Now you can see here on the screen, I have a variety of different scan bodies. You're going to want to choose the scan body that is appropriate for the workflow that you're trying to complete. For instance, if you're simply scanning the implant to send it to the laboratory of your choice, you're going to want to call the laboratory and ask them which scan body they would like you to use. The reason is every laboratory uses different design software, and different design softwares recognize certain scan bodies and don't recognize other scan bodies. So that's why it's important that you call your laboratory and ask them which one they would like you to use. Now, for instance, if we were going to be making the implant crown in-house with our CEREC machine, there's a specific scan body that you must use for that. Or if you're going to utilize a workflow like Atlantis for a custom abutment and then make the crown in your clinic, you're going to want to use a different scan body for that. Regardless of the scan body that you use, though, there's some core principles that you need to keep in mind. Obviously, the scan body needs to be the right size for the implant and needs to be seated fully. You can also see in this picture that I have here that you're going to want to have all of the information scanned down to the gingiva. You're not going to want to have any holes in your scan body or in the adjacent teeth that are relevant for the restoration. So you're going to want to have a complete scan, just like if you were scanning for crown and bridge, for an orthodontic appliance. The same scanning principles apply. You're just scanning the implant with a scan body in it rather than there being a prep there or a tooth there to scan. So let's look a little more specifically into some unique workflows that would come with, say, an OmniCam or a Prime scan. I mean, we could go through all the different scanners and the variety of options out there, but I think the OmniCam and the Prime scan offer some unique workflows that I think it's important for us to address today. The first one would be with the Atlantis, Simplant, or Azento workflows within Dentsply Sirona. Now, the Atlantis workflow is a very unique one, especially if you have a CEREC machine. What Atlantis allows you to do is to send your scan to them. They will fabricate a custom abutment for you. And while that custom abutment is being made, they will send you back what's called a core file. A core file will allow you to import the digital impression with the custom abutment already in it before you ever physically receive the abutment, and you can design your final crown. That way, when you receive the final abutment, you simply marry the abutment and the crown together in the patient's mouth. It's a very slick and easy workflow, allows you to be more custom with your abutments and not have to rely strictly on a tie base. Azento, that's a different workflow. It's essentially an implant in a box. And regardless of whether you choose Azento, Simplant, or Atlantis, you're going to want to use what's called the IO flow. So it looks like this. This IO flow is recognized by any of these three workflows. However, you can't use it in your CEREC to make an implant crown. So that's kind of where things get a little bit different. So remember, the IO flow is strictly for these workflows. Now, if you want to do everything in-house, if you want to restore your implant with a tie base, you don't want to send anything out for a custom abutment or send anything to the laboratory, then you're going to want to use something that looks like this. This is a Sirona scan post. Now you can see that we have two components here. We have a scan post and we have a scan body. This scan body simply slides over top of the scan post and gives your CEREC software all of the information it needs to design the perfect implant crown. Now, when we're utilizing this scan post and scan body setup, you cannot send this to just any lab. If you needed to send this to a lab, you'd only be able to send this to a lab that's using Sirona lab software. So it's a bit of a proprietary scan body and scan post. But if you're going to make everything with your CEREC in-house, you're going to want to use these components here. And now with an OmniCam or a PrimeScan today, these caps would be gray. The white ones were associated with a blue cam in the past, but they would be gray today. But what's really important to remember when using these scan bodies and scan post is that these two notches need to line up perfectly. So what you would do is you would implant put the scan post into the implant, screw it in, then you would slide this little cap over top and align the two notches. Now, an easy way to see if they are aligned is you simply pick up your OmniCam or your PrimeScan, you turn on the camera, and you just place it in next to those notches, and you'll see on your screen whether these notches are lined up or not. That's extremely important so that when you mill your final crown, it fits perfectly onto the tie base and the notch that's on the tie base. There's a lot more to cover here, but I think this will give you a bit of a glimpse into what it takes to actually scan your implants and develop a final restoration. If you have further questions, please reach out. We're more than happy to help you. Or if you're going to be sending the scan to your laboratory, simply reach out to your laboratory and they will help you with the proper selection of the scan body needed for their software.